and I'm very excited to share with you about a new discovery which we have made at the Madras Diabetes Research Foundation at Chennai. We're very proud to say that we have discovered a new type of diabetes. This discovery is a joint discovery between the Madras Diabetes Research Foundation, MDRF, at Chennai and Washington University at St. Louis, Missouri. The team of scientists led by Dr. Colin Nichols at the Washington University at St. Louis, Missouri, and our team, the genomics team led by Dr. Radha Venkatesan in her department, and our colleagues at MDRF, we have made this very important discovery. Let me explain to you in very simple terms. There are many forms of diabetes, type 1 diabetes, type 2 diabetes, and then there are other genetic forms of diabetes where a single gene is affected. And one of these genetic types of diabetes is called as maturity onset diabetes of the young, or MODY. Now, MODY itself is not of one type. There are at least 13 different types of MODY which have been described. Each one has a different clinical presentation and it responds differently to treatment. Now, when you have a defect in the pancreatic beta cell due to a mutation which occurs, this can produce these forms of genetic diabetes. So when a particular gene called as the ABCC8 gene is affected, it can produce a form of diabetes which is called as neonatal diabetes. This occurs before 6 months of age, in other words, in newborn children. Now, to get neonatal diabetes, you have a mutation in this ABCC8 gene, and we call it as a gain of function mutation. So if you have a gain of function mutation, the blood sugar goes up, and if this occurs in childhood, we call it as neonatal diabetes. If it occurs in adults, we call it as one form of MODY, MODY 12, also called as ABCC8 MODY. Now, in the same mutation, you can also have a loss of function. That means the gene is mutated with a loss of function. If you have a loss of function, you don't get diabetes, you get the opposite of diabetes, and that is low sugar or hypoglycemia. This can also occur in newborn children, and we call this as congenital hyperinsulinemia with hypoglycemia. Children get fits and they get low sugar symptoms. So a loss of function produces low sugar or hypoglycemia, and gain of function produces either neonatal diabetes in neonates, in children, or MODY 12 in adults. Now, we are a referral center and we get cases with suspected MODY referred to us from all over the country. When we were doing genetic studies at the Madras Diabetes Research Foundation, we found a series of cases which were not fitting into any of the 13 known MODY subtypes. When we did the genetic testing, we found that they had a mutation in the ABCC8 gene. So we first thought that this is MODY 12 because it occurred in adults. But to our surprise, we found that instead of having a gain of function mutation, which produces MODY 12 or ABCC8 MODY, these set of patients whom we studied actually had a loss of function in the ABCC8 gene. As I told you earlier, if you have a loss of function in this particular gene, it should produce low sugar. They should have come with hypoglycemia. Instead of that, they have come with high sugars or hyperglycemia, and they are presenting in adults with this peculiar form of diabetes. So we did a lot of experiments which confirmed that they actually had loss of function mutation. And initially we were very surprised. But with our collaborators, Dr. Colin Nichols and colleagues from St. Louis, Missouri, we were able to show that despite having the loss of function mutation, these people actually developed hyperglycemia or diabetes. Now, why did this occur and how did this occur? What has happened is that these young adults who have now come with diabetes must have earlier had hypoglycemia. They must have had this congenital hyperinsulinemia. They must have had hypoglycemia as children, milder forms. And over a period of time, this hypoglycemia got converted into diabetes because the mutation started changing. And while the loss of function still remained, the mutation was still a loss of function mutation, instead of getting hypoglycemia, they've now developed diabetes. So in this paper, which we published in the famous American journal, the American Diabetes Association journal called Diabetes, what we are proposing is that the gain of function mutations should be classified separately, and this loss of function mutation, which has led to a new form of diabetes which has not been described so far, should be given a separate name. We are proposing that this can be a new form of MODY. Now, when you have the gain of function mutation and either have neonatal diabetes or the ABCC8, which is the MODY 12, and we have seen enough cases of that, they respond to a tablet, a very common tablet called sulfonylurea, which is one of the oldest and most commonly used tablets. In this new form of diabetes that we discovered, they do not respond to sulfonylurea. In fact, when you give them sulfonylurea, the sugar seems to go up. So they are completely different from the ABCC8 or MODY 12 and from neonatal diabetes. We tried various permutation combinations and finally they responded to some of the treatments. In the future, we will be doing more studies to find out what is the best form of treatment for this particular type of diabetes. But at this time, we thought that we should publish our findings and tell the world that we have discovered yet another type of diabetes, yet another type of MODY diabetes, which we feel is a completely distinct form of diabetes. And I'd like to congratulate Dr. Radha Venkatesan, the head of genomics, and her whole team and my other members at the Madras Diabetes Research Foundation, as well as our collaborators at St. Louis, Missouri, at Washington University, where they were able to guide us to do the proper experiments in their lab as well as in our lab to prove that this is a new form of diabetes. Thank you for watching.